Welcome, everyone. I'm Joy Boston at the Public Health Law Center, and we'll welcome you to our second part of a two-part series, Baking Anti-Racism and Health Equity into Public Policy. Our first part a few months ago was brought to us by the by the Network for Public Health Law, and there we talked about unpacking racial and health equity impact assessments, the legislation, tools, and strategies for community-centered change. That was giving us the baseline for our equity impact assessments and what they mean and how they look. Today's webinar is sponsored by the Public Health Law Center, and we're exploring the impacts and challenges of equity impact assessment implementation, getting more into the process and implementation of our HEIAs. So again, I'm Joy Boston at the Public Health Law Center. I use she, her pronouns, and I'm a senior staff attorney on both the climate justice and healthy eating and active living teams. The Public Health Law Center is a public health law and policy organization with 20 years of experience working in the areas of commercial tobacco regulation, climate justice, and healthy eating to promote health equity and confront the social determinants of health. We're located at the Mitchell-Hamlin School of Law in St. Paul, Minnesota, the tribal and treaty homelands of the Dakota Oi'te since time immemorial. In these tribal lands, Indigenous peoples have joined together in community, stewardship, and spirituality, upholding traditional values and legal principles. At the Public Health Law Center, we believe everyone deserves to be healthy. We collaborate with others to reduce and eliminate commercial tobacco, promote healthy food, advance climate justice, and address other causes of chronic disease. We do this through legal technical assistance. What this means is we provide legal research, and we provide research related to policy development, implementation. We do this through different publications and community-based resources, as well as trainings. We do not directly represent clients, and we do not, so we don't take any clients, and we do not lobby. We provide our legal technical assistance as education. And with that, let's begin the second part of our two-part series, exploring the impact and challenges of racial and health equity impact assessments, focusing on the implementation. Today's first, we have three panelists today join us. First, we have Jammarie Pena, is a performance management and data analyst with the Office of Legislative Oversight in Montgomery County. In this role, Jammarie analyzes the racial equity and social justice impact of bills that are introduced to the County Council and works on research projects studying county policies and programs. Prior to the Office of Legislative Oversight, Jammarie worked in several roles focusing on economic security, including small business training and technical assistance for family child care providers, financial employment coaching for families impacted by homelessness and domestic violence, and grants management and development for a community development financial institution. Then we'll have Kate Lang-Perez, who is a policy analyst, a health policy analyst, serving both Washington State Board of Health and the Governor's Interagency Council on Health Disparities. She conducts health impact reviews, analysis of statewide proposals to determine likely impacts on health and equity in Washington State. Kate is a public health generalist, well-versed in the social drivers of health and root causes of health inequities. She brings a multidisciplinary approach and a health and equity in all policies perspective to her work. Kate is experienced in policy analysis, evaluation, and research methods, both qualitative and quantitative. She values the opportunity to highlight lessons learned from research and to amplify the context and content expertise of communities most directly affected by Washington State policies. And our final presenter is Rolando Huevas, and he is the Associate Director of Policy at the Council Office of Racial Equity, CORE, in Washington, D.C. He leads the development of racial equity impact assessments, analysis of legislation proposed by the D.C. Council to evaluate potential impacts on residents of color. Rolando also authors many of CORE's assessments with a primary focus on housing policy. In addition to his analytical work, He manages CORE's policy assessment workload and team of analysts, helping the office meet its mandate of reviewing nearly all proposed legislation through a racial equity lens. Rolando is a public policy generalist with experience in policy analysis, research, and project management. His work is grounded in commitment to truth, courage, and a deep focus on supporting policymakers in designing legislation that meaningfully advances equity for residents of color in the district. And with that, I'm excited to turn over to our first presenter, Jean-Marie, introducing us to some of the process of implementation in Montgomery County.
Thanks so much, Joey. Let me just share my screen. Okay. So good afternoon. Thanks so much, Joey, and thanks so much, everyone, for having me today. So I'm Jean-Marie Pena. I'm an analyst in the Office of Legislative Oversight in Montgomery County, Maryland. And I look forward to sharing more about the racial equity and social justice impact statements that are produced by our office. So your first question might be is what exactly is a racial equity and social justice impact statement? So a racial equity and social justice impact statement, or a RESGs, as we call them, is effectively a HEIA for policies that are introduced by the Montgomery County Council, specifically for bills and zoning text amendments. So RESGs evaluate the anticipated impact of bills and zoning text amendments on racial equity and social justice in Montgomery County. And we define racial equity and social justice, or RESJ, as both a process and a goal. It's a process that focuses on centering the needs, leadership, and power of Black, Indigenous, and other people of color, or BIPOC, and communities with low incomes, with a goal of eliminating racial and social inequities. So before getting into more specifics on our RESGs, I'm just going to take a step back and share a brief history of how RESGs came to be in Montgomery County, which is tied to the history of the county's Racial Equity and Social Justice Act. So the Racial Equity and Social Justice Act was a law that was enacted by the Montgomery County Council in November of 2019. And this law prioritized RESJ as a goal for Montgomery County, and it also created an infrastructure in the county for the government to advance racial equity and social justice. So the RESJ Act was a sweeping law. So some of the major components of the law are listed on the slide. So for example, the law created the county's Office of Racial Equity and Social Justice. But among these things, this law also required the Office of Legislative Oversight to draft RESGs for all bills introduced by the council. And later the next year, the act was amended. And here again, I listed some of the major changes on the slide, but particularly for RESGs, it added the requirement for our office to also draft them for all zoning text amendments introduced by the council. So the RESJ Act was a culmination of an effort that took place over a year and a half. So back in 2018, Councilmember Nancy Navarro and then Councilmember, now County Executive Mark Elrich, introduced a resolution that committed the council to developing a racial equity policy framework for Montgomery County. And it just might be helpful to know that around the time that this was happening, there was really growing support for racial equity efforts in the region. So just a few years prior, Fairfax County, which is a neighboring county in Virginia, adopted One Fairfax, which committed the county to intentionally considering equity in their policies and programs. And then we also had philanthropic groups such as the If Foundation, who were supporting efforts within Montgomery County to advance racial equity. But shortly after the resolution was adopted, our office published a report that was previously commissioned by the council that described promising practices and recommendations for the county to advance racial equity in government decision-making. So moving to 2019, Councilmember Navarro was elected by the council to serve as council president. And one of her top priorities during her one-year term was to develop a racial equity and social justice policy that reflected the needs and priorities of the community. So early that year, Council President Navarro and now County Executive Elrich launched community conversations on racial equity and social justice. So over about 4 months, 1,000 community members participated in conversations that were sponsored by the county and by groups in the community. And then in June of that year, the council held a work session to discuss the 2018 report that was released by OLO, and also to discuss findings from the Montgomery County Racial Equity Profile, which provided data on local racial disparities in various policy areas. So finally, in September of 2019, Council President Navarro introduced the RESJ Act, and she introduced it with the support of the 8 other members of the council who all co-sponsored the bill. And finally, one work session was held for the RESJ Act, and it was enacted a few months later in November 2019. And like I previously mentioned, the act was amended later the next year in December 2020. So now I'll get more into the details of our RESGs. I'll describe the broader framework that we use to analyze the racial equity and social justice impact of policies, as well as our process for developing RESGs. So in order to understand racial equity and social justice impact, we need to apply the RESJ lens to our analysis. And applying a RESJ lens involves seeing, thinking, and working differently to address the racial and social inequities that cause racial and social disparities. So since our society has been structured in a racialized way, policies are going to have differential impacts by race and ethnicity. And they're often going to sustain or exacerbate inequities for BIPOC, regardless of whether that is the intent. So approaching our analysis with the RESJ lens allows us to understand what those differential impacts by race and ethnicity will be and what is driving them. Also, in our analysis, we typically focus on impacts by race, and we do this because BIPOC are the most harmed by inequities, especially when you consider the outcomes of BIPOC within other marginalized communities, such as BIPOC with disabilities or BIPOC or LGBTQ. So while we do typically focus on racial equity impact when appropriate, we do also consider other social justice constructs in our assessments. So as far as just the high-level logistics of developing a RESGs, so as I mentioned earlier, a RESGs is required for each bill and zoning text amendment, or ZTA as we call them, that is introduced by the council. So bills and ZTAs are usually introduced during meetings of the full council on Tuesdays. But usually by the Thursday before this meeting, we'll know if a bill or ZTA is scheduled to be introduced. And we'll also have a staff report that has a text of the bill or ZTA and some more information that I'll describe shortly. But after a bill or ZTA is introduced, we generally have 21 days to complete the RESGs and publish it to the OLO website. So we have 3 staff members in OLO who support with the development of RESGs. So I'm primarily responsible for drafting RESGs for bills. And we have another staff member in OLO with expertise in planning who drafts the RESGs for the zoning text amendments. And we also have a RESJ supervisor in OLO who does a substantive review of all of our RESGs before we publish them. But before RESGs are published, they undergo several layers of review internally, which includes the review I just mentioned from our RESJ supervisor. It also undergoes a substantive review from the director of OLO and a proofreading review from our admin specialist. So now diving deeper into the content of our RESGs. So each statement has 4 main sections that we're writing: the general purpose of the bill or ZTA, the context of race and racism in the policy area, the anticipated RESJ impact of the policy, and recommended amendments to improve the anticipated RESJ impact. So starting with the purpose. So the main question we aim to answer here is, what does a bill or ZTA seek to accomplish? So in this section of the RESGs, we explain how the bill or ZTA changes current policy. So to do this, we mainly rely on staff reports. So like I mentioned in the last slide, the staff report usually includes or will always include the text of the biller's ETA that is being introduced. And it also usually includes a description of the policy from the legislative attorney who is staffing it. But aside from this base information, the other supporting information in staff reports really vary. So for example, sometimes you will have a memo in the staff report from the sponsoring council member that explains or provides more details on the policy and explains its intent. But really, this isn't always the case. And regardless of the level of detail, usually the staff reports will rarely explain the potential or intended impact that a policy will have or is expected to have on racial equity and social justice. So sometimes we do have to engage with the departments that would be responsible for implementing the bill to get a better understanding of the changes the policy would make and on its potential impacts on RESJ. So next is the RESJ context section, and the main question we aim to answer here is, how do racial and or social inequities exist within the bill or ZTA's policy area? So in this section of the RESGs, we explain the historical and current context of racial and social inequities in the bill or ZTA's policy area. And we also provide data on racial and social disparities, or rather those observed differences that we see in outcomes by race and ethnicity within the policy area. So on our team, it is a really important principle to never provide data on racial disparities without explaining the past and present context of racial inequities. And we do this because it helps to highlight the structural factors that are causing racial disparities instead of allowing readers to fall back on false narratives that blame racial disparities on cultural differences or on individual choices and behaviors. So writing this section of the RESGs usually requires the most research. So sometimes there are comprehensive sources that summarize research on racism within a policy area. However, many times this is not available, so we have to do the work of compiling and summarizing research from various sources. But in doing this, we do try to make sure that the RESJ context we provide is as local to the county as possible. So the next session is the anticipated RESJ impact, where we evaluate the anticipated RESJ impact of a bill or ZTA. And we do this by answering two questions: who benefits or is burdened by this bill or ZTA, and what racial and or social inequities could this bill or ZTA strengthen or weaken? So for the first question, we identify community members who would benefit or be burdened by the policy, and whether there are any disproportionalities among these community members by race and ethnicity. So if we identify that the policy is going to impact a specific group of constituents, so for example, renters or constituents within a specific geography, we try to present their demographics by race and ethnicity. And we compare these to the demographics of the county as a whole to understand if there is any over or underrepresentation by race and ethnicity among the groups who are impacted by the bill. So we found that the census's American Community Survey is a really helpful resource for understanding disproportionalities. So for the second question, we identify how the policy could impact existing racial and social inequities. And here we do usually lean on our research from the RESJ context section to understand this. So bringing together the information on impacted community members and the potential impact on racial and social inequities, we determine the anticipated RESJ impact of a policy. So this slide just describes the 5 categories that we use to score the anticipated RESJ impact of bills or ZTAs. These are indeterminate, negative, minimal, positive, and equitable. So I won't talk through each of these, but I will note that the distinction between a policy being scored as positive or equitable is whether RESJ is prioritized in the policy. And then finally, the final section is recommended amendments. And the main question we aim to answer here is, what strategies could help mitigate a negative RESJ impact? So we are required to provide recommended amendments for policies that are anticipated to have a negative RESJ impact. But we do also provide considerations for policies that are anticipated to have other impacts if we do see changes that could help to improve its RESJ impact. But to write this section, we do often rely on best practices from research that could be implemented to advance RESJ in the given policy area. So now I'll share some outcomes and lessons learned since we've started working on RESGs. So this table summarizes the RESGs we've published as of April 2025 and their RESJ impact scores. So since we started writing RESGs back in September of 2020, we have published 180 RESGs for bills and 37 RESGs for ZTAs. And like you can see on the slide, the most common RESJ impact score for bills and ZTAs is minimal, which are policies we have found that sustain racial and social inequities. And so finally, just a few lessons learned from our work on RESGs. So first, it is helpful to be flexible and open to change in developing RESGs. So the process of developing RESGs has and continues to change and improve over time. So for instance, when we first started writing RESGs, our primary emphasis was on providing data on racial disparities. But over time, we realized the importance of providing the historical and current context of racism to accompany the data. Next, building a library of RESGs has benefits that extend beyond the assessment of specific bills or ZTAs at hand. So for example, building this library has helped us to be more efficient. So as new bills and ZTAs are introduced in similar policy areas, we can reference the RESJ context and analysis of past RESGs. RESGs are also helpful for community members to advocate for policies that advance RESJ, and decision makers can also use them to understand the drivers of racial and social inequities in different policy areas as they're developing policies and programs. So the next, as I noted earlier in our definition, advancing RESJ requires censoring the needs, leadership, and power of BIPOC community members. So currently, we don't include the perspectives of BIPOC community members in our RESGs, but we are conscious of the important role that RESGs could play in amplifying the community's voice. So as jurisdictions are developing their REIA processes, this is something really important to consider from the very beginning. And then finally, developing policies that advance RESJ require more than RESGs. So before policies are introduced, there is a lot of work that policymakers need to do to apply a RESJ framework while the policies are being developed. And a big part of this is community engagement to truly develop policies that address the needs and priorities identified by BIPOC community members. So our team is currently working on updating our tool that helps guide council members on strategies that are necessary to develop policies that advance RESJ. So I will pass it now to Kate for her presentation. Thank you.
Thanks so much, Jan-Marie. I love seeing all the similarities between what we do. Give me one moment as I share my screen. Okay. Okay, should be up there. Hi, my name is Caitlin Perez, and I use she, her pronouns. I'm a health policy analyst with the Washington State Board of Health, and today I'll be sharing more about our health impact reviews, which are a tool used in Washington to assess how proposed state legislation may affect health and equity. So kind of both pieces. I'll start by sharing a bit of context about our position within state government, as well as our statutory authority to conduct health impact reviews. And then I'll provide a high-level overview of our program, as well as how findings have been used to inform statewide decision-making. So to orient you, we are a health and equity in all policies tool. So we start with this Washington state government public health system. Included are 4 pillars: the State Board of Health, the State Department of Health, local health jurisdictions, and sovereign tribal nations and Indian health programs. And together, these 4 pillars really work to protect the health of people and communities across Washington state. And our health impact reviews are completed by staff serving both the Washington State Board of Health and the Governor's Interagency Council on Health Disparities. So I'll give you a quick kind of where those two sit. Established by the state constitution, the Washington State Board of Health is a policymaking board, and members are appointed by the governor, and we have between 16 to 22 staff, depending on the portfolio. The board has broad statutory authority and is responsible for developing policies and rules that prevent disease and promote and protect the public's health. Then in 2006, Senator Rosa Franklin and the legislature created the Governor's Interagency Council on Health Disparities. And the council was really created as an interagency work group to identify priorities and create recommendations both for the governor and the legislature with the intent of eliminating health disparities both by race, ethnicity, and gender in Washington state. And so that's kind of where we started in 2014. Our health impact reviews kind of as they are now, and our methodologies kind of move forward. And today the council is really committed to promoting equity for all historically marginalized communities by focusing on racism to undo all forms of oppression. With the council's creation, the legislature granted the board the responsibility and authority to conduct health impact reviews in collaboration with the council. And the HEIA program is currently funded at 2.6 FTE, and our team includes 3 health policy analysts, including me, each of us with a master's degree in public health. So health impact reviews, what is it? An HEIR is an objective, nonpartisan, evidence-based analysis of a proposed legislative or budgetary change to determine its likely impacts on health and equity in Washington state. So really, health impact reviews offer both a health in all policies and an equity in all policies lens through which to view proposals. And then HEIRs were really created to provide legislators information before a policy is enacted about whether it may exacerbate or improve health and equity conditions for populations experiencing inequities. So the analysis really systematically provides legislators with information to inform decision-making, but it does not include recommendations. This tool is only available to legislators and the governor, and it can be requested on any proposal at any point in the legislative process. So from draft legislation in a Word document to a bill that's been introduced and is moving through session, as long as the proposal hasn't passed into law, we can conduct a review. And we complete analyses by request in part truly because of the large volume of legislation introduced each year. So this legislative session in 2025, more than 1,900 bills were introduced in Washington state and 423 were passed into law. So with that in mind, we have a request model. By law, we must complete each HEIR in 10 days when the legislature is in session. So therefore, we often are working with a queue of requests and we complete HEIRs on a first come, first served basis. We have greater flexibility when the legislature is not in session during our interim. And at that point, we're often conducting reviews on larger omnibus type bills or on more complex topics that require a greater amount of research or connection with key informants. And these reviews can take a couple months to complete as staff are supporting other projects for the board and council as well. So when we receive a health impact review request, we start by exploring all potential connections to health and equity. So both ways the proposal may improve health and equity, as well as ways it may negatively impact health and equity. So we're considering health and equity broadly, including the root causes or those structural and social drivers of health. So for example, we're considering potential inequities due to racism, geographic location and isolation, economic status, to name a few of them. We then develop a logic model or a visual pathway connecting provisions in a proposal to health and equity. And for each step in that visual pathway, we are conducting specific reviews of published literature to determine how provisions may impact health, who's most likely to be impacted by the proposed change, and then how that change may impact equity. We also conduct key informant interviews to talk with a range of people to understand how a proposal, if implemented, may impact people in Washington state. And as always, we review any available data related to the proposal. So here is a simplified look at the types of contributing information that we rely on to conduct health impact reviews: data, published literature, information shared by key informants, all develop the evidence base for each analysis. And a crucial step in the HEIA process is that identifying communities and groups who may be affected by the proposal. And this is really an iterative process for us. We don't use a checklist. We learn about communities who may be affected by the bill through our reading of published literature, through our key informant interviews, and through available data. And then we also draw on our own experience working on past HEIAs. And then I really, really appreciate Jean-Marie bringing up kind of that context, because as we're incorporating information from various sources into our HEIAs, our team is really mindful of how we frame that information. And so we're using our understanding of root causes of health inequities to identify and discuss those underlying drivers of inequities. So specifically, we know that inequities are influenced by social and structural drivers that systematically marginalize some groups due to their identity, circumstance, or group affiliation. And for example, poor health outcomes, not inherent to someone's race, ethnicity, but they're really about the health outcomes being influenced by those social and structural drivers of health, like racism, which contributes to inequities in socioeconomic status, access to healthcare, inequities in interactions with medical professionals, each of which affect health. So we recognize all of those factors, then inequities can either be exacerbated or alleviated by intersecting identities and experiences. And so really looking at those intersections and teasing them out for policymakers. And then we recognize that different communities may be impacted differently, even by the same bill provision. And so how do we talk about that? As part of this work, we do conduct key informed interviews for every health impact review. And again, we talk with a range of people with subject matter expertise, both that content and context expertise. And these conversations really are critical in helping us understand kind of whether we're interpreting the proposal correctly, that we've accurately portrayed that pathway to health and equity, and that we're thinking about the potential impacts comprehensively. So how do we get those contacts? Board and council members may connect us to folks in their networks who are either in community or at agencies. We may also reach out to people who have provided public testimony on a proposal if it's at that stage of the work. Connect with folks who we've spoken to during previous health impact reviews. And then we use a snowball methodology from there and ask folks who we should be talking to as part of the review. We often speak with staff at state agencies who may be responsible for implementing the proposal if it were to pass. We'll talk with researchers and professional organizations in a policy topic area, often in Washington state, but sometimes more broadly. We also speak with staff at community-based organizations, and whenever possible, we talk with people with lived experience who are most likely to be directly impacted by that bill. So as best practice, going through this process, we share draft legislation or draft language with key informant interviewees before publishing the final review. And this really allows interviewees the opportunity to review the language for accuracy and clarity, and to ensure that we're accurately portraying the information that they shared with us during those interviews in the final report. In 2024, we began reimbursing and issuing compensation to eligible interviewees for their time informing the HEIA process. Eligible participants are provided an electronic gift card for their participation, and that compensation is provided to folks who are not otherwise being compensated for their time informing the HEIA process. So not someone who's doing this on their staff time, but someone who's doing this out of their day because it's potentially going to affect them or others that they know. And then based on evidence from the review of literature, the review of literature, our interviews, data, and equity findings, for each step in that visual pathway and logic model, we determine a strength of evidence. So the ratings are really based on criteria that our staff developed that consider the amount of research, appropriateness of the study design we're looking at, execution, and generalizability to Washington state. And we currently have 7 strength of evidence categories ranging from unclear to very strong evidence. And really the strength of evidence provides us a standardized approach so that it really doesn't matter which trained analyst is assessing the body of evidence, we'll come to the same conclusion because we're working with those same assumptions. And we conduct training and inter-rater reliability testing and collaboratively discuss any article if there's a question regarding an assessment. So once a health impact review is complete, we compile a final report, which includes an executive summary that details the strength of evidence for each step in our logic model. Think of that as like the 1 to 3 pager that decision makers may be using. You can see an example here on the right. And then the full report includes our methods, logic model, analysis of those health and equity impacts in that context, as well as a list of annotated references, because we know so often published literature is behind paywalls. So we share that final report with the requesting legislator, legislative staff, board and council members, and then all of our key informants that we spoke with as part of the health impact review, as well as other interested parties who've signed up for our listserv. And then the final report becomes a public document on the State Board of Health's website. And if the legislature passes a version of the proposal that the health impact review findings are still relevant to, then the board and council will also send a memo to the governor to share that a health impact review was completed and those findings as the governor considers action on a bill. So since 2014, we have completed 137 health impact reviews at the request of 64 different legislators and the governor. We reach out to and have worked with both Democrat and Republican legislators in both the House and the Senate. Here, the dark blue portion of the bars shows the number of HEIAs that we complete during legislative session. Light blue shows the number that we've completed during interim when the legislature is not in session. And you can see that to date, the majority of our work occurs during session with that 10-day turnaround that's required by law. And then our team regularly conducts outreach with legislators, which really it's education, letting them know what tools are available to them. And we'll speak with as many legislators and staff as we can, both ahead of session and then during legislative session while we're writing as well, where we really see that as an important outreach and driver of request, just because there's just so much happening during legislative session and there's so many tools available to folks, and especially for new legislators and new staff, it's important to kind of get in front of them, share what's available, and then reminding legislators that we've worked with in the past that we're still here and available to them. And then here's a breakdown of our health impact review requests by topic area. So as you can see, over 80% of our reviews are in bills related to those social drivers or determinants of health: employment, education, economics, and other policies that impact health, not the typical like health policy. Among those, our most requested topic areas are the criminal and civil legal systems, behavioral health, and education. And then to give you a sense of the type of proposals that we work on, this fiscal year, we analyzed bills with topics ranging from judicial sentence modification, the sale of flavored tobacco products, municipal solid waste systems, that was new for us, and then housing support programs. And we found that really HEIAs can be completed on most policy topics. It's really, the tool isn't a good fit for bills that address an administrative fix or that initiate a study or a work group, as it's just not possible to predict how a work group or study might proceed in its work going forward. So at the end of each legislative session, we do follow up with all HEIA requesters to evaluate our process and really understand how they may have used findings. And over the years, we've heard that legislators use findings in many, many different ways. So some legislators are using the information from an HEIA to inform their own decision-making about a process or policy they've put forward. Others have shared that HEIA findings add value by laying out information and evidence about a particular bill in one place, and the fact that like we're in that kind of nonpartisan space of providing a health and equity lens, but not advocating one way or another for policies. Legislators have also used findings of HEIAs to prepare comments about a bill or have conversations with their colleagues. Some are really interested in that first step, that implementation. If this bill were to pass, what would the next step be? Others have been really interested in the health and/or equity impacts. We've had constituent concerns about a bill prompt legislators to request to learn more about what the evidence may say for that policy. And then we also know that legislators have used findings in budget negotiations or to support budget provisos included in the final budget. And legislators can request on both their own bill or a colleague's bill. So some legislators have requested really to learn more about a topic or inform their vote on a bill in the future. And then we also conduct surveys with our key informants, and through those surveys, we've learned that staff at community organizations and state agencies also use findings. We've heard that findings have been used to advocate for specific language or discuss equity impacts with legislators, and that they're being able to reference recent literature on a particular topic is helpful. And then while we track where proposals move through legislative session, we often don't know if our analyses specifically spark a change to a proposal. But sometimes we do learn about how findings are used, and those follow-up calls with legislators and surveys can give us a little bit of insight. So for example, during the 2023 legislative session, we completed an HEIA request on a proposal to change state laws and testing requirements for language access providers. And then while we were conducting interviews for the health impact review, we learned that the requirements would likely limit the pool of certified medical interpreters and therefore decrease access to professional medical interpretation services for people with a non-English language preference. So we provided that context in the final health impact review. And we later learned that legislators use the HEIA findings to write an amendment, to form a work group and find a path forward. And that updated bill did pass the legislature. The work group submitted its final recommendations to the legislature in 2024. So again, many ways it can be used. Sometimes we know and sometimes we don't know. We know legislators have shared it with other states, and yeah, it's exciting. So I'll wrap up really quickly here. So for health impact reviews, in addition to the work that we do when we're not actively conducting a review, we also provide research support for both the board and council. We've researched topics like health as a right, health justice, extreme heat, and then we're also constantly improving our practices. So whether that's through kind of our tracking of our requests and feedback that we receive from key informants through surveys and legislators through our follow-up calls, all of those are kind of that constant process improvement. So I'll leave it at that for now because I think I'm close to time. And then all of our health impact reviews are available on the State Board of Health's website. And I'm excited to be part of today's discussion, and I'll pass it over to you, Rolando.
All right, thank you so much, Kate. All right, let me try to just share my screen real quick. In the meantime, I know I'm the last one here, so I can't see anyone, but if you want to take a good stretch, and that would be a good time for that. I know it's hard to be online. Okay. All right. So hi, everyone. My name is Rolando Cuevas. And I'm with the council office, the Washington, D.C. Council Office of Racial Equity. So today I'm going to talk a little bit about what our office does, how it was created, and how specifically we draft racial equity impact assessments, and kind of get a little bit more into our methodology and how we landed on it. All right. So first, some introductions. Then we're going to talk about a bit of what CORE does. Then I'm going to talk a little bit about just REIAs in general, what that means to us, our guiding principles as to how we draft a REIA. And then specifically, I'll talk about like how we actually get to like a very specific conclusion on our racial equity impact, and like what methodology we use to get to those specific parameters. I think some people had some questions around research, so hopefully we can answer some there. And then lastly, I'll talk a little bit about some considerations for establishing like an office similar to ours in other jurisdictions. So first, to put some faces or names, we are a mighty team of 8 people in this office. So everything that you see here that we talk about today is done by us. And before it used to be done by 4 people, then 6, and thankfully now we're at 8. And all of our information is here, and we're always open to speaking with everyone. Essentially, we're structured. We have a director, deputy director, 3 associate directors, 1 that focuses on research, engagement, and then me on policy. And then we have policy analysts who focus a bit on the HEIAs. But I'm going to be honest, all of us write HEIAs. So this is not like, oh, this person does that. Like the mandate is huge. So we all of us are always writing assessments regardless of our individual functions. Before kind of getting into our office, I want to kind of highlight that our office was created by a piece of legislation in 2020 called the Racial Equity Achieves Act, also known as the REACH Act. And one of the big things, I'll talk about what that piece of legislation does in terms of creating our office, but a huge thing that piece of legislation did is that incorporated the definition of racial equity in the DC code, meaning it's in the law. And I want us to be very kind of like, I've had it here, to say again, the racial equity means the elimination of racial disparities such that race no longer predicts opportunities, outcomes, or the distribution of resources for residents of the district, particularly for persons of color and Black residents. I included that slide here because really that is like our guiding star. Like that is what we guides all of our work and what we always reference back to when we're talking about our work and the purpose behind it. So in addition to that definition, that piece of legislation creates 2 racial equity offices in the district. It created 1 racial equity office for the executive, which is the mayor's office of racial equity, and it created another racial equity office for the legislative body for Washington, which is the councils, hence our name is the Council Office of Racial Equity, CORE. So what our office does is 3 general areas. Primarily, we write racial equity impact assessments on all permanent legislation that the council proposes. Again, I'll say that again, on all permanent legislation. That means that's every policy area under the sun. We do not kind of decide which bills to analyze or not. It is our mandate to analyze all of them, regardless of policy area. And in the span of 4 years, I forgot to mention our office was created in 2021 on MLK Day. So in the span of 4 years, I think we've analyzed over 330 bills. Yeah, it's been a journey, but we'll get into that. But in addition to HEIAs, we also provide trainings for council staff to help them kind of better design legislation with the racial equity ends, and also kind of just and other trainings as well. And then the last thing we do is we also, when we have time, we work on independent research. So we work with different organizations like MITRE, for example. We worked on to create a report on wealth, on Black wealth, particularly in the district, and like the factors that contribute to barriers within that space. So these are the 3 general areas, but primarily, again, as I mentioned, our time is consumed by the big mandate around the HEIAs. So what is a racial equity impact assessment in terms of how we define that? So essentially, a HEIA is a careful and organized examination of how a proposed bill will affect racial equity in the district. And specifically what that actually means to us is that like every time one of us is writing a HEIA, we are answering this one question. If this bill passes, how will it impact Black residents, Indigenous residents, and residents of color in DC? That is kind of like the summary of what we're trying to answer in a HEIA. Now, what is included in a HEIA is pretty consistent across. 1, it has a bill summary. 2, a background section. 3, the meat, which is the racial equity impact section. And 4, a further consideration section. All of them are critically important. The bill summary is essentially, it sounds pretty straightforward, but it's one of the hardest parts in the HEIA. We actually rewrite all the legislation ourselves in the HEIA in plain language. We aim for an 8th grade reading level. And we do that for 2 reasons. 1, because it's just about accessibility. We want to make sure that any resident, any person in DC should be able to pick up this document and understand what this bill is doing without having to have a legal background, technical background, context, or understanding of what the technicalities of the bill are doing. As you can imagine, that's very difficult to try to break things down, very complex thing and break things down. However, the second benefit of this is that it a lot of things come to come to light when you start breaking down kind of jargon, right? So it also just helps us better analyze the legislation and also helps like council better understand the bills that they're proposing. Because once we start asking questions of like, oh, what does this actually mean? Sometimes they'd be like, actually, we're not really sure. Or like once you start kind of breaking things down, so much can actually happen. And we have a lot of anecdotes of how many changes actually happen at this stage before we even get to kind of the what you would think is like the important part in the RIA. But like this is critically important and does take actually a lot of a time. Then the background section, we kind of go into this typical policy analysis, like looking for the evidence, looking for the problem, evidence behind the problem, evidence behind the solution that being proposed, historical racism, historical context around legislation, and all that information. And all of that pretty much sets everything up for the racial equity impact section, where we really go into the specifics of like how individual provisions are going to impact the outcomes and the lives of Black residents and residents of color, and then also, if even possible, just racial equity just generally. And then the further considerations is kind of like where we talk about maybe pieces that are not fully like directly provisions in the bill, but maybe spaces that the council or the committee can consider to expand on, or should consider. I mean, it's pretty much in the title, but like what, based on the research that we've done and the time that we've had, what other things maybe they could jump off of, and look at. So this is kind of like a general idea. And then we have an assessment limitations area, which is important for us. That's kind of like a piece in the RIA that we include, where we talk about that it's impossible for us to possibly consider everything under the sun when it comes to racial equity, but that doesn't necessarily mean it's not important or it's not relevant. And we always want to be upfront with that like this is like an effort that also has a space of humility, and like we're doing as much as we can with what we can, but that certainly doesn't mean that we'll capture everything. And if we don't say something, it doesn't necessarily mean it's not important. So it's super important for us. All right, so what do we think about when we're writing a RIA? One of the things that we're always thinking about is, I think Jen Marie mentioned this, but we have to disaggregate data by race and ethnic group, because that is the only way that we can actually be explicit about knowing what how people are actually experiencing different outcomes, whether it's health, education, or those pieces. Otherwise, we're kind of just talking in generalities. It's always important for us to research the historical trauma, especially in a city like in DC. There's always context as to why policy has existed or why it was created or the intentions of why it was created in the first place. And we have to speak that into existence, not only for justice, but also because it also helps us better understand like how to improve on that. And then a big piece is we also just do policy analysis, period. I think a lot of people forget that like before you can even make a conclusion on racial equity, you have to get to like do all the upfront work of just doing policy analysis. And that's sometimes looking at the evidence, as kind of Kate was talking about earlier. Do we even know this works? I think that's what this is like when we actually do that. It's like, do we know what does academia say? What can we look at? Does this actually work? And more importantly, like also who is it working for? I think a lot of the times we say like, oh, the evidence shows it's really effective, but who are the people that we're talking about? Do we have evidence showing that it's effective for Black residents? Do we have studies that are primarily looking to people of color and the effectiveness on its impact on outcomes for people of color, and not just generally? Because again, that helps us get very specific. Another big piece is here is who identified with the policymaking process. This is key. A lot of the times, as we can imagine, legislation is very sometimes reactive to a certain complaint or groups of people who have resources and power to raise those complaints. And it's important to understand like that context of who was involved in like even citing the problem to that kind of influence the legislation, because a lot of the times it's not people of color. A lot of times they weren't included in the process, and that context is important. And then another big piece here is really the person's experience A to Z. So if we're talking about, for example, like an application program online, great. We all think online is great, but like, what does that actually mean, for example, for like a Black resident who might not have access to the same internet access, for example, and like kind of walking through that process so we can connect the dots, going back to the effectiveness piece. And then lastly, this is like the main thing is like then identifying like the potential like racial equity impacts. And like this piece is what I'm going to talk about next, of like, how do we actually say this in a specific way and how do we go about it? So I will say that like our office and our methodology of how we determine racial equity impacts has changed. When our office was created, essentially we had a similar scale that, as Jean Marie had mentioned, about like a bill might worsen or improve racial equity. And what we found, given like the wide variety of policy like levels in DC, we were having a hard time. Like, for example, one time we'd be assessing a bill on like bike lanes, and then the next day we'd be assessing a bill on changing the entire criminal code. And then, for example, maybe both of those situations we'd say like, oh, well, this bill is like worsening racial inequity, but that was really hard because it wasn't really capturing the depth of what we were trying to say and like and what the actual impact on Black residents that those bills were having. So then we kind of went back to the drawing board and developed what we call a structures versus symptoms model. And essentially, what this essentially means is that anytime we're kind of working on a bill, we're looking at if the bill is dealing with structures of racial inequity, or if it's dealing with the symptoms of racial inequity. So essentially what that means is structures deals with kind of institutional racism, like the pillars that are like keeping inequity in place. And then symptoms are like the outcomes that we can observe from those institutions. And when we assess a bill or a provision, we look at, is this bill like dealing with the symptoms? Like, is it trying to like fix like a put a band-aid on a problem, which isn't important, or is it dealing with like the structure? One way to kind of think about this is that like, imagine like a game where the rules were designed to advantage one player over another. And a bill that's improving symptoms is like giving disadvantaged players like better equipment to better perform for one round, but the rules are still the same. So something like that would be like providing down payment assistance to low-income households to buy a home, right? Like it's helping the problem now. However, fixing the structures is about changing the game itself so everyone has a fair chance. So like in housing, this can mean like improving infrastructure and opportunities so Black residents can live and enjoy like the benefits from home equity in the communities that they live in, right? So that being able to have low access to low interest loans and not being like displaced from the communities that they live in and spaces like that. So like that's kind of one example. But then that helps us really be able to kind of break down different bills in different ways. Now, our conclusions always have this structure. So if you read one of our HEIAs, they all will like score or assess a provision in this way, whether it's a symptom or a structure. We'll say the bill provision X, for example, will either harm, likely harm, maintain the status quo, likely improve, have a negligible impact, inconclusive impact on X outcome, let's say educational outcome for a specific group being like, let's say, Black students. So we focus on the bill provision. We talk about like the scale here, depending on the evidence that we were able to identify and the history that we have. Then we talk about if it's a symptom, but if it's a symptom, we'll usually talk about an outcome. And then we'll talk about the specific group. If we're talking about structures, which is really just talking about racial inequity or equity just generally, then we'll say like this bill exacerbates racial inequity in the district, for example. We can talk a little bit more about this, but this really, really helps us stay narrow and focused and consistent with how we assess provisions from pretty much every policy area. Now, when do we actually publish HEIAs? We get 2 chances to publish a HEIA, but however, all of our HEIAs are always published before they're voted on. So first, the council introduces a bill, then they have a public hearing. Then after that public hearing is when we can publish a HEIA on the introduced version of that bill. But then we also get an opportunity to publish a second HEIA right before the committee votes on the bill. So if the committee says, we want to vote on this bill after we got input from the community, sometimes they change the bill a lot of times before they vote on it. They will share that to us at least 10 business days before they vote on it, so we can actually decide if we're going to provide it like an updated HEIA based on the introduced version. I forgot to mention that on the introduced version, we have 30 calendar days to assess the first draft of the bill. But for the second one, right before they vote on it, we get 10 business days. And then the entire council votes on the bill. Of course, our findings are not binding. Council can still vote however they want, but our work is public. And so once we publish a HEIA, then it's up to the public to decide how they use the HEIAs to push for things. So as I mentioned earlier, we've drafted over 330 HEIAs in the past 4 years. Our work is not constant. Sometimes we're drafting bunch of RIAs in a few weeks and a few months, and then we are doing some trainings, or sometimes we're kind of, you know, in like a very, very busy mode. We, as I mentioned earlier, we drive RIAs on every policy area from housing, energy, economic development, justice, everything you can imagine. I can talk a little bit about the impact of our RIAs, but as mentioned earlier, our RIAs have impacted changes in legislation, bills not passing, impacts in other places. Honestly, the impacts of our RIAs, it's hard to capture because sometimes we don't even know how they're being used internally. But I can talk a little bit about that during the discussion if people are engaged, are interested. But also like our RIAs go way beyond DC, and I think that was a big surprise for us. We always sometimes hear or get emails or messages of like, oh, hey, we're using this RIA for this type of bill in our jurisdiction. And it's like, oh, well, I had no idea that it was being used that. And even internationally, we worked with organizations who reach out to us who are interested in how to structure their office or their work around similar to the way we do. Again, I want to stress that our work is public, and that is a huge, huge foundation for us, like in terms of pillar of the impact of our work. We have a database on our website that kind of has like a high level summary of like bills in terms of and the different assessments of different provisions within those bills. What as you'll see here in this example, you know, as you can imagine, a bunch of bills have a lot of different provisions, so it's really difficult for it's very difficult for us to have just one conclusion or top line conclusion, because that doesn't capture everything in the bill. So that's why we have different kind of conclusions for one bill. But yes, our work is public, and we publish before a bill votes on the committee votes on a bill. And then I know I'm out of time here, but I will just provide some kind of updates, some information on like what it takes to kind of create like an office like ours that we've talked about. So racial equity being considered from inception. When it comes to hiring, I could talk a little bit about how hiring and our hiring process works, and like why that's super critical in terms of having the team that we have. The resources that were required from when we started to where we are now. As you can imagine, it's been a ton of work. So now we have a better idea of what it actually takes to run an office like this. The importance of timing and efficiency, and how flexibility was so important in terms of like us being able to arrive and learn from our initial starts of the office. The importance of deciding if your mandate's going to be broad or narrow. As I mentioned, our mandate is broad because we assess every piece of legislation, but that might not always be possible depending on your situation. Again, flexibility for iteration and growth, which I don't know if it was always intentional to give us that space, but it was definitely necessary. And then also that systems outlast people. As we know, a lot of the times in local government or any government, turnover is high. So a big important piece for us is to like make sure that how do we create an office, a methodology, and a system that like can survive whether we have new people or whether new people in council leave or go, or whether we come and go. And we can expand on that later. But again, please visit our site, visit our database. And if you want to hear about all of our RIAs that we're always sending out, here's our QR code to sign up for a newsletter. So thank you.
Thank you, Rolando. I know that I had the opportunity to put this webinar together with all these fantastic people and resources, in Jean-Marie, Rolando, and Kate. But I mean, I am still learning, and I would so appreciate all of your time. We can move into our panel discussion, and if folks want to come back on screen. We got a few questions in the chat that some of which we were able to answer live, and I feel free again, folks, to bring more questions in, and I'll try to group them together. But we have the next 25 minutes to see what similarities there are, talk more about challenges, if anything came up for our presenters while they were sharing their information. I will start with one question and give you each a chance to address it. What common data challenges, limitations do staff run into? And I know we sort of got into this, but when you're having these kind of data challenges, limitations, what have you done to try to address this? I know if somebody's ready to jump in.
I'm happy to
Kick off.
Because I think we always sometimes would get this question when we present in other places too. And I think there are two things that we've learned and that we'd like to highlight. One is that there's always like a strong emphasis of like quantitative data and like wanting to like prove something. And I think although that has a role in that it's important, it is important to also recognize that like not knowing something is sometimes equally as important as like knowing it. And I think a lot of the times there's a lot of pressure for policymakers to like show that they're doing something because they know that that's informed, but sometimes we don't know that. For example, like if people go on our website and go on our public database, you'll notice that a lot of our provisions or a lot of conclusions end up being inconclusive, meaning that we just don't know. We cannot definitively say if like that's going to have the impact, whether it's good or bad, that the intention is having on that for the bill. And I think there's power in that. I think there's power in the humility of not knowing. And not just that, it also gives us in those reels, you'll notice like we'll say like a lot of times it is because of data limitations. We'll say, we can actually know that this intervention or this policy like proposal will have this impact because we do not have data disaggregated by race, for example, in this space to be able to conclusively say that it's going to benefit for X outcome, for example, for Black residents. And I think sitting with that and like actually we've seen those conclusions like actually motivate then council sometimes to include that in their bills and actually ask agencies and be like, oh, actually make it a requirement as part of this new program to be collecting that information. And that's how that conversation sometimes can start. So yeah.
No, and I think that came up a little bit even in our first webinar. Like what don't, what's the data we don't have? What don't we know in terms of the structuring of a REA bill or process? Thank you. Yeah, Jean Marie?
Yeah, totally agree with what Rolando shared. I'll say just to add a little bit to his point on, when there is a lack of data, sometimes that is something that we elevate in our recommended amendments as an opportunity to advance racial equity in a policy, is including, a provision in the bill to collect data on how on the impact that the policy will have by race and ethnicity. And I'll also share that, sometimes even when a direct data point isn't available, there sometimes are proxies that, you can kind of reference to get an understanding too of the issue that you're looking into. So one example, for example, in our county is eviction. So we don't have data on eviction filings by race and ethnicity. So what we've done in the past to try to understand eviction risk is look at data that we do have, for instance, on people who are applying for rental assistance by race as a proxy for eviction risk, and also housing cost burden by race and ethnicity, which is something that is provided by the American Community Survey. So that could be helpful to understand disparities by race as well.
I agree with both Rolando and Jean Marie, and thinking about one of the reasons why our team has incorporated the community voice is because of some of those gaps, and identifying like where in Washington there is knowledge that we can incorporate into our work that might not be able to, answer all of the questions, but can give some context around some of those data limitations, and recognizing that there's also mistrust, and understandably mistrust with sharing information with government as well, or researchers, because of harm in the past and present currently. So thinking about kind of all of those different layers and how to weave that into the work to be kind of that transparent and honest source of information. So.
No, thank you all three, and I know that's kind of as we've been talked about developing this, that resonated a lot, and coming over from the first webinar to talking about those challenges. And I know each of you kind of got into this, but especially Rolando talking about like finding other jurisdictions using your process. What have been a question related to that? Because that sounds like that wasn't planned. What have been some of the other unplanned impacts of your local, state, district equity impact assessment process and implementations? Things you didn't plan for, impacts you didn't plan for.
So I can start this one off. So kind of to like the last point that I made and the lessons learned of my presentation, one thing that we realized in working the registries, while that they are very valuable, they are at the same time pretty limited in achieving that ultimate goal of, enacting policies that are equitable. So they are really helpful as a check, on like, or a temperature check on where the policy is in terms of like whether or not, it'll advance racial equity and social justice. But a lot of the effort to actually ensure that a policy will be racially equitable is the work that's being done on the front end by the council members to apply a racial equity framework when the bill is being developed. So part of, what our team has been working on is to give those tools to council members. So we've been having trainings to help them understand, what are those things that you should be considering when you're developing a bill. So for instance, thinking about community members who are going to be impacted, thinking about, what is the historical context of racism in the specific policy area in which people in the community should you be engaging on developing this bill to make sure that it reflects their needs and priorities. So yeah, I would say that is, one big thing that we've learned in our process is that registries are really helpful and important, but a lot more needs to happen in order to get to that end goal of having policies that are advancing racial equity and social justice.
Yeah, I would agree, Jan Marie, thinking about the just one tool in the toolbox isn't enough. And so thinking about kind of where we sit, health impact reviews can be requested, as I said, it can be a Word document, draft form. It can be something that died one session and they're trying to understand kind of in the future. But there are also just so many other points and policies. And so like thinking about where those data limitations are and, should there be an assessment written in? And if there's an assessment, how do we make sure that assessment is really taking that equity lens into that work? And so we've worked with other state agencies, other players within Washington State who are developing racial equity tools and thinking about like how do these complement one another? How do we build on and the knowledge that we've developed and the strengths of other offices so that there are really tools that are working in cohesion with one another rather than duplicative. So all those different pieces.
Yeah, I'll jump in to add a little bit from our experience. I think we've definitely learned a lot, I would say, over the past 4 years. I think when we start this work, when people think of just the racial equity impact assessment for like the bill, they think, well, what impact did it have like on that specific bill? And that's very much a valid question. But what we've learned is that there's so much more that happens and how our work is used beyond just the impact of that specific bill in that specific moment. Sure, we've seen like bills, sometimes get amended or maybe not even passed or get, stopped. But a lot of the times we also see like bills introduced like years later that are kind of using some of the language that we mentioned even previously. And we're like, we kind of see, I mean, they won't tell us like, oh, it's because of your assessment, but we'll start seeing kind of, patterns of things that we mention. Um, and not just that, I think within also just council itself, it also changes the culture and it changes the level of rigor that just goes into just the design of legislation. I think by having like an office like ours, who really has to like, cite and be rigorous with everything that we say in order to get to a specific conclusion, it just elevates the rigor in terms of just like evidence-based policy making. And within that, I think it also just it makes it more responsive. Our goal is to make obviously the bill legislation more responsive to the needs of residents of color. So that I personally like notice when I'm reviewing now bills or having conversations with council. I'm like, oh yeah, the conversations I used to have 2 years, 3 years ago are different now to the conversations I'm having today in terms of like around evidence and effectiveness and proof and things like that. But outside of council, as the biggest surprise, like we had no idea that our RIAs would be cited by other cities who reach out to us. We're like, hey, we saw you guys wrote about a bill that our council is trying to propose, or hey, we're using HEIAs to like explain legislation to people who come to our community organizations meetings because it's really complicated and we didn't know how to rewrite it, or like people don't understand what it's actually doing. So it was refreshing to read something neutral that like worked. So that, honestly, those are the things that we hear. But as Kate mentioned, it's impossible for us to be able to capture the things. We're lucky when we hear about it, and we're always so happy, and we track it, and we have kind of our ways of keeping those anecdotes because it's ways to kind of like also just motivate us to keep going too, because this was work can be very difficult and tough writing about this every day. But yeah, I think that is the biggest surprise, that just like the impact way beyond like the initial bill that we thought it was focused on. The last thing I'll say is that there's a lot of power in record. And a lot of the times I think, people can get disillusioned by like, oh, well, it didn't change this bill or they still passed it anyway. But there is power of having this RIA, at least in our case, be part of the record. And it's part of the public record and it's part of that bill and it's part of that bill's report. And we're hoping that, as you build that literature and that on that bill, that we can see future references. So, yeah.
That actually is a great segue. Thank you, all of you. And that's a great segue to a question that came up from our attendees, which you started all address. See if there's anything new you want to say about this, but do you conduct any follow-up on bills that have passed and included HEIA? So like maybe, and I know this process isn't decades old, but like a year or a couple after, is there like a follow-up process?
I'll say for Washington State, no, not if something's passed. Once something's passed, we're kind of out of our mandate within statute is that we're looking at that kind of prospective look. That doesn't mean that others can't or won't. It's again thinking about kind of the partner agencies and who's positioned to do that kind of follow-up assessment. But it's not something that's part of our process or that we're really aware of at this time.
Sorry, go ahead. Go ahead, Chumry.
Okay. Yeah, we also don't do any follow-up as a part of our ResGs process. So more generally, the office that I work in that produces the ResGs, Office of Legislative Oversight, we do like more extensive studies on county policies and programs. That is dictated, by our work program that the council puts together for us. So if the council chooses to, include a follow-up on a specific bill in our work program, that could be a way to do a follow-up on an RESJ impact statement, specifically or on the bill more broadly. But as a part of our, normal ResGs process, we don't do that.
Yeah, I'll jump in as well. Like I think, and I'll maybe explain like why maybe we don't, beyond just resources and those things, and which we all have are constrained on, is I think a big piece that I want to make clear is that we assess the bill at the policy design stage, but just because a bill is passed, how it's implemented and so many other factors that come into play can change everything. I mean, we can say something about a bill, but then ultimately how it's implemented and who it's in, if it's funded or not funded, that's a whole other piece that changes everything. So necessarily doing like a one-to-one evaluation, I don't think would really like match up. That's not to say, however, that because we've existed now for 4 years, there have been bills that now like have come up that are similar to things that we've already written about like before. And we've reached this like new stage where now we can actually now recite ourselves in previous work, and we're like, actually, we wrote about this already. And this is actually still the same. And actually, maybe, to kind of like highlight that this is maybe a similar bill or intention trying this again. But I also wanted to note that I mentioned earlier that the executive, which is the mayor, and they're in charge of implementing the legislation at the end of the day. So agencies are in charge of implementing legislation. They have their own office of racial equity. Now, their mandate is not ours. They have different mandate in terms of working with agencies, collecting data and doing trainings and things. So we don't do, again, like a one-to-one evaluation. It's like we don't do an evaluation assessment of the bill and they assess the implementation. That's not how it works. But it does kind of give us like an eagle eye view, I guess, of like how things are changing. And ultimately, like we don't have to get complicated with it. Like, do we see changes in outcomes? or not. We do have that information. We do know if the disparity between incomes between white residents and Black residents is changing or not. And ultimately, like, that's what matters. Not necessarily so much did this one bill like change that one thing. Like, that's so difficult to prove. But what matters at the end of the day is like, are we seeing racial equity being like narrowed or eliminated? As I mentioned earlier, like that is our mandate. That is what we are aiming to do. So if that's not changing, then we might not know why, regardless of our conclusions, but at least we can see that, like, it's maybe not at the policy level, design level, maybe it's implementation or other spaces. So hopefully that helps a little bit.
No, it does. And I suppose it points to, you're all going through that process of the implementation phase of how to do the racial equity and health equity impact assessment. States and localities and at the county and council level that are looking at trying to pass HEIA legislation, how that implementation of the actual process and analysis and data can look really different than the actual, because each of you are experiencing similarities and differences in doing your health equity assessments, reviews, and reports. A question came up a little bit about community and in terms of sometimes we see suggested ways to approach HEIA and really emphasize and elevating community recommendations, involvement is part of the process. When and how was community involved in the process of and I know, Jamie, you kind of talked about this a little bit as well in the beginning. How was community involved in analysis, reports? Is there community council? I guess however you kind of want to approach that question of how community has been involved in recommendations for process or information sharing, anything related to that.
Sure, I can share first. So in Montgomery County, to develop the Racial Equity and Social Justice Act, we did have pretty extensive community engagement. So like I mentioned, the county sponsored community conversations. So they had really large scale events where they were engaging community members on racial equity and social justice to understand, what their priorities would be for this kind of policy. And the county also created a toolkit for people in the community to also host their own conversations as well to inform the policy. So community engagement was a really big piece of developing the RESG Act, where our RESGs come from. But in our implementation of the RESGs and in doing our analysis, community engagement has been something of a challenge for us, mainly because of the short time frame that we have for producing them. So like I mentioned, we have 21 days to produce the RESGs, and a lot of times bills are being introduced, not in isolation. So we have a few bills that are being introduced at the same time. And so it makes it difficult to really engage with BIPOC community members to understand, how these policies will truly impact them. But we do realize that that is a really important piece and a really important role that our impact statements could play. So it's something that we've been thinking about how to incorporate. But really the main way now that we've been trying to encourage that work to happen is by trying to train the council members and their staff on, making sure that they're doing really strong community engagement when the policies are being developed. Because again, that really is the stage when it matters for developing a policy that is really gonna be racially equitable.
Thanks, Jan-Marie, for taking the first attempt at that one. Got my thoughts in order. So with health impact reviews so 2004, there was a task force that came together, and there were 5 pieces of legislation that came out of that work, 2 of which, one created the council, one created health impact reviews. And so there was involvement at that stage. And then in 2018, 2019, our Health Disparities Council members, so we get connection to community through our members who both represent state agencies, our ethnic commissions, as well as 2 representatives from community. And so there are connections there that we will have information shared with us or kind of networking within community. And we also were told, we need to have more than literature. There's so many gaps in literature. And so how do we incorporate those conversations? And again, those tight turnarounds are really hard to develop any meaningful relationships. And so we're really cognizant of that. We actually have 10 days inclusive of weekends because the legislature is working through weekends. So that's kind of our 10 days are really tight. Interim allows us a lot more flexibility and time to schedule calls, get connected, build some trust so that we can have those conversations. But during the session, we're really relying on folks who will make connections for us, and then we will bend over backwards to make times that work for community members work for us, specifically folks with lived experience. And it's always, we do the reach out as best we can, and we hope that folks are able to connect with us, and we recognize that that might not always happen. And sometimes we are lucky and we get to update a policy. And so a lot of our update an HEIA on a similar policy. So a lot of the other legwork is already done, and we can really focus our time on that connection to community and making sure that lived experience and that community voice is part of the ultimate deliverable. And at the same time, that takes a lot of effort and a lot of time. And so it's something to consider in your process, like how to do it well, because you want to do it well. So yeah, something we're constantly that iterative process.
Yeah, I would just add, there's a lot of overlap here among us. I would say, for us, it's similar in the way. I think the biggest way we kind of incorporate a lot of community input into our REIAs is through the hearing process, and we try. It's not the best process because, as we know, not everyone has even the remote same access at all to be able to even have the time or resources to go and testify for a bill. But we do go through all of it, and we do try to elevate the voices of people who do take the time to be able to go, particularly for residents of color. So that's one space, given the limitations that we've had up until now. That being said, we have restructured our office a few months ago, actually more than that, to have a person dedicated to community engagement, and we've been working on that, and it's one of our priorities for this year to figure out, going back to Kate's point around intentionality, how can we be intentional about doing it right and also being more proactive. I think a lot of the times, of course, we try to keep, we go every time when we're invited to events, we'll go, or sometimes organizations will invite us and want to have conversations with us, we'll attend. I mean, we'll talk about our work. A lot of the times, a big part of our work is really just trying to let people know what we do. I think a big push was that community is the reason our office exists. There was so many advocacy groups and a lot of community organizing to create, to pass the REACH Act and create our office. And I think a big piece for us is to let those same organizers know, be well, now we're here. So let's and now we have more people. As I mentioned earlier, our office has grown, and thankfully we're in a much better place. So now we're in a place where we can really be more intentional about it, because it is critical to have that input in our REIAs. Of course, when we have more niche bills, we definitely reach out to certain organizations that are in the community that we know are more frankly experts in that area, to kind of get a pulse check. Do you think we're on the right track here? Are we fully understanding what's going on here? Is this actually what was this feeling captured or observation captured during the testimony, or do you think that you guys can have a chance to go, or things like that? So we'll kind of do check-ins like that, but again, we want to have something more intentional and standard moving forward than that. But that's where we are at the moment.
No, I appreciate that, and the similarities and challenges and approaches and the work towards improving and moving forward. I want to note that we're at time. I know we still have some participants. I have one last question, but if you have to go, please know that we will be sharing the recording and all the resources in the next few days to week, along with a survey. So if you can hang on, my last question is, what do you wish, what do you know today that you wish you knew earlier? In your, I mean, that could be life, you know, but like, but specific to, equity impact analysis. In your process, is there one thing that, gosh, if we had started this a year ago, several months ago, 5 years ago, it would have helped? And maybe there's a few things.
Yeah, I think, you know, to the point that I made before, I think it would have just been helpful to understand just the importance, how important it is for council members to really be applying a racial equity framework as they're developing the bills before they're introduced and before they get the RESJ impact statement check on our end. And I think that had we had known that from the beginning, there maybe could have been a way to incorporate that into the policy. So maybe there could have been more, you know, requirements there for council members to demonstrate, you know, how they were engaging community, or how, you know, what research they did to understand the history of racism, or, you know, the best practices for advancing racial equity and the policies that they're developing and then introducing. So so yeah, I would definitely say that would have been helpful for us to know from the beginning to, you know, incorporate that into the RESJ Act as well.
Yeah, I would definitely say that I think two things stood out to me. One is it would have been good to like have been resourced from the beginning and like had a full understanding really of what it was to like assess legislation to the level that we were asked to do. Because our office certainly has gone through difficult moments of people of us like working so many hours and really trying to like reach that standard of like quality that the work deserves. And I think that's a big piece that like I wish collectively the we, I don't know who the we is, but we would, it was out of our control, but that like had that been known generally back then. Because one thing that we always try when we talk to other jurisdictions or other cities that we try to stress is that like our work is only as good as really like the resources that we can provide it, like and our word is only as good as the last read that we're writing, you know. So like we can't have like a day where we're like, oh, this one is not as good as these other ones. Like we have to be intentional, and it has to be good, because ultimately like that's our word, it's our value, it's our own contribution. And I think early on when we were in the office, when we were four of us or six of us, like we were doing the impossible really to reach this mandate, and like and working on three RIAs at the same time, or getting seven RIAs out in a week, or like things that were like, when I think now, I'm like, I cannot believe that happened. And we did it, but it's just not sustainable. And I think like learning about that, knowing about that now, knowing about what it takes to have that office, that's why we take these moments to be able to share that, is because it's critically important. You don't want to burn out the people that are willing to do this work and taking already the initial sacrifice to do the work. So I think it's incredibly important. So
Everything that you just shared feels very relevant. So ditto that. And I think one other piece, just thinking about, I think we've all shared with you that the process changes over time, because you know more and you come up against different policy challenges, and but having a strong foundation and then building from that, and having systems set up so that you know we've worked on this before, let's go back to that database of all of our literature and all of our resources for that, and we can pull from there. And so just like having systems set up too makes doing the impossible mandate that we get within resources more manageable. And so really being intentional about how to set up the different structures that you need, whether it's kind of how you're tracking everything, what the different approaches are, who are your contacts, who's working on different work that you have assigned topics on, and like building that out in a way, again, as people leave, that someone else can come in and pick up the work and continue kind of passing that baton forward. So yeah, thank you all.
Thank you. Thank you. I think as I'm seeing comments and questions, everyone has learned so much and wants to probably continue this for the remainder of the week and being in this conversation. But thank you again. I will note that we will push out the recording, the presentations, as well as have folks' contact information. The questions that we didn't get to, we'll try to address in that larger follow-up email with some resources as well. And just on behalf of the Public Health Law Center, thank you all so much, and everyone be safe and well.
Thank you so much.
Thank
so
you.
much. Sitting through this long day on a Thursday. Really appreciate it.
Thanks.
Thank you all.